Hello, this is the second video for WellSpan Spine Care patients who are having surgery. The main goals or objectives of this video are to let you know what to expect in the hospital after your surgery and how to care for yourself when you go home. In the first video, you learned the best ways to get ready for your surgery and what to expect when you get to the hospital or surgery center. Now, we can take a look at what to expect after your surgery is finished. The nurses in the PACU will watch your vital signs like your heart rate and breathing status. They will also monitor you for pain and nausea. They may ask you to wiggle your toes and fingers. This is called a neuromuscular assessment. You may notice a few things when you wake up after surgery. Your nurses will be there to help you understand anything that you need to know and help put you at ease. You may notice that your eyes and face could be puffy when you wake up. Depending on the type of surgery you had, you may have been face down, and this is what causes puffiness in your face. This puffiness will go away shortly and is not something to worry about. You may notice when you wake up that you have a urinary catheter called a Foley. Some patients have this type of tube placed in them to drain urine during surgery. Not all patients get a Foley catheter during surgery, but some do. Sometimes the catheter is removed before you wake up from surgery. Some surgeons will want your catheter kept in until the day after. The nurses in the PACU may also use a bladder scanner. This scanner will check the amount of urine in your bladder to make sure that you have emptied your bladder after you pee following your surgery. Your surgeon may put a surgical drain in you. This is so the nurses can check on how much drainage you may have after surgery. Surgical drains are taken out 24 hours after surgery for most patients. It is normal to have a sore throat after having anesthesia because of the breathing tube that was used during surgery. If it is too uncomfortable, you may be able to ask your nurse for medicine to help with the soreness. You'll be asked to do some deep breathing and coughing so the nurses can check on how well you are breathing after surgery. To help with your breathing and prevent pneumonia after surgery, you will use an incentive spirometer. This is a device that will help you take deep breaths and keep your lungs healthy. You should use it 10 times per hour. The hospital staff will show you how to use it. The hospital staff will also help you get in and out of bed after surgery. You should not try to get out of bed by yourself. It will also be important for you to drink plenty of fluids when you are awake from surgery, but you should not eat until after you have passed gas. Pain is normal after surgery. We use a pain scale to help you rate the level of your pain. 0 means no pain at all. 10 means the worst pain you could possibly imagine. Pain is different for everyone. Before your surgery, try to think about what level of pain would be hard for you to tolerate. This way you can talk with your nurses after surgery about when you may need to take more pain medicine. Pain control means that you feel okay with eating, sleeping, and moving around. Here are a few different kinds of pain you may feel after surgery. Incisional pain is soreness or pressure that you may feel in the area where the surgeon made a cut or incision. Muscle spasms are a kind of pain that can feel like tight grabbing sensations. Nerve pain is common after spinal surgery. This can feel like numbness or tingling. It may also feel like a shooting hot pain. We can help you with your pain by using medicines like opioid pain medicine or other types of pain medicine like Tylenol. The surgeon may also order muscle relaxers to help with any muscle spasms or steroids to lower your amount of swelling, which can cause pain. We give medicine as liquid or pills that you take by mouth, or we can give them through your IV, which goes directly into your vein. You will start with IV medicines, but we will want you to switch to taking pills by mouth as soon as you are able to after surgery. It is important that you pay attention to your pain. You want to stay ahead of it. This means you should tell the nurse about your pain when you first start to feel uncomfortable and not wait to take medicine until the pain is unbearable. Make sure to tell the nurse if the pain medicine is not working and ask any questions about managing your pain. We want you to understand how to best manage your pain before you go home. We have other ways to manage your pain too. For example, we will encourage you to change positions often. This will help with stiffness and soreness from being in one position for too long. It is also good to walk around when you can. Ice packs are another great way to help with pain and swelling after surgery. We do sometimes use heat packs, but only if your surgeon says this is okay. Finally, there are relaxation techniques like meditation or breathing exercises that you can do to help with pain. For more information on managing pain after surgery, please take a few minutes to watch the video from WellSpan called Managing Surgical Pain, Non-Opioid Options and Safe Opioid Use. Constipation is when you have a hard time passing stool or are passing stools less often. It can happen after taking opioid pain medications. Surgery also makes constipation more likely because you may not be moving around as much as you normally do. Your appetite and diet could also be different after surgery, and this could put you at risk for constipation. If you haven't had a bowel movement for 3 days after your surgery, it is a good idea to talk to your surgeon or primary care provider about taking a laxative for your constipation. Walking around often will also help you prevent blood clots. These can form when blood gets clumped together and blocks the flow through blood vessels. Blood clots are a risk after having surgery. They can be life-threatening if they develop in the leg and move to your lungs. This is called a pulmonary embolism. We'll take steps to help prevent blood clots. In addition to getting you up and moving after surgery, we may also use sequential compression devices. These are sleeves that are put around your legs that help to keep your blood flowing. You may also need to wear compression stockings. These put gentle pressure on your legs to help with blood flow. The staff in the hospital may also teach you how to do ankle pumps. These are exercises you can do to help the blood move through your legs. In addition to the prevention strategies we will use, we also need you to pay close attention to how your body is feeling and let us know if you have any signs or symptoms of a blood clot. Pay attention to any pain in your legs. Pain from blood clots usually gets worse with standing or walking. Also, pay attention to your skin where you feel the pain. Check to see if it's red or feels warm when you touch it. Keep an eye out for any swelling in your legs. Swelling can be a sign of blood clots. Once you are home after surgery, it will be important that you call your surgeon's office if you notice any of these symptoms. Your surgeon may need to order an ultrasound to check for blood clots. Call 911 right away if you notice symptoms like chest pain or shortness of breath. These could be symptoms of a pulmonary embolism. Remember, walking and moving around is the best way to prevent blood clots. Make sure to get up at least once every hour while you are awake and move around for 5 to 10 minutes. If you are staying in the hospital overnight, you will probably meet some rehabilitation specialists called physical or occupational therapists. Physical therapists can help you learn the best ways to move your body after surgery. Occupational therapists can work with you to see if you need any type of special equipment that can help you with your daily activities, like getting dressed while you are recovering. Speech therapists are also available for patients who might have trouble swallowing after neck surgery. You will learn more about these types of therapists and the techniques they will teach you in part 3 of this series. Your therapists and nurses will encourage you to move around after surgery. However, there are precautions you will need to follow. Spine precautions include no BLTs, which means no bending, no lifting, anything more than 5 pounds, and no twisting. If you are having neck surgery, there will be things that you should not do after surgery until the surgeon clears you. You are allowed to sit, stand, and walk after surgery, but you are not allowed to bend or twist the back of your neck. It is important that you keep your back and neck straight. Do not reach above your shoulders or head after surgery. For example, you should not do something like hang a shower curtain after surgery. Reaching above your shoulders or head will put too much strain on your neck. Use a log rolling technique to get in and out of bed. You will learn this technique in our 3rd video, and it will also be taught to you by a therapist before you go home from the hospital. Do not lay on your stomach. Sleep or rest on your back or side. Not all patients get a neck collar after surgery, but if your surgeon orders one for you, make sure that you wear it. Trouble swallowing is called dysphagia, and it's normal after neck surgery. After neck surgery, you may feel pain in your throat. It may also feel like there is something stuck in your throat when you swallow. These are normal symptoms. They may last a few days or up to a few weeks after neck surgery. Please call your surgeon's office if you notice that these symptoms are not getting any better as time passes after your surgery. Your surgeon might need to order a swallow test for you. Please make sure to also tell your surgeon if you have any of the following: coughing or needing to clear your throat often when you are eating or drinking, bringing food or liquid back up in your mouth after you try to swallow, feeling like you need to swallow more than 3 times each time you take a bite or sip to get it down. You are not able to swallow anything, even your own spit. Because neck surgery can cause trouble with swallowing, patients who have neck surgery need to eat a special diet after surgery. Neck surgery patients should eat soft foods. Examples of soft foods are Jell-O, mashed potatoes, pasta, and eggs. Small bites of these foods are best. Do not eat anything hard, sticky, or crunchy. You should also use a bendable straw to drink after neck surgery. Using a straw that bends will help you bring the straw to your mouth without having to move your neck forward or backward. Call your surgeon right away if swallowing gets worse or you cannot eat or drink anything. Let your surgeon know if swallowing does not seem to get better 5 days after surgery, or you still need to eat special food 2 weeks after neck surgery. No matter what type of spine surgery you are having, your surgeon may have other precautions that you need to follow. The rehabilitation therapists and nurses will go over your specific precautions with you before you go home. Most patients who have had spine surgery stay in the hospital for 1 to 2 nights. Some patients may need to stay for more nights, and some spine surgeries are done as same-day surgeries. It all depends on the type of surgery you had and how well you are recovering after surgery. It is important to make a discharge plan before your surgery. A discharge plan is your plan for when you leave the hospital and go back home. You will need someone who can stay with you for the first 48 to 72 hours after you get home from the hospital. Please make sure to talk to your surgeon right away if it's not possible for someone to stay with you at home after surgery. You will also want to get your home ready for when you come home from the hospital after surgery. You may sleep in your own bed after you go home. Be sure to put away any of your throw rugs. These can cause you to trip while you are recovering from surgery. It is helpful to have frozen meals prepared ahead of time. Finally, you may want to have someone take care of your pets while you are recovering. There are some other things that you will need to learn before you go home. The nurses in the hospital or surgery center will make sure to go over all of these things with you before you leave. The nurses will review your prescriptions with you before you go home. The nurses will also review signs and symptoms of infection with you. They will want you to look for any redness or warmth around the area of your incision. You will also need to check your incision for any yellow, green, or smelly drainage. A fever of 101 degrees Fahrenheit or higher, or a very bad headache, can also be signs of an infection. This type of headache is called a spinal headache. They are a risk of spine surgery. A spinal headache feels better when you are laying down, but gets worse when you are sitting or standing. The nurses will also teach you how to shower and change your bandage at home. Bandages are also referred to as dressings. The surgeon can choose from a variety of dressings, so it is important to follow the surgeon's instructions for incision and dressing care during your recovery. Most patients are allowed to shower when they get home. Showering instructions are based on the dressing used for your surgery. You should not get into a pool, bathtub, or hot tub until your surgeon tells you it's okay. Do not put any lotions, creams, or oils on your incision. Do not let pets near your incision or in your bed the night before surgery and for 2 weeks after, or until you meet with your surgeon at your follow-up appointment. Again, be sure to follow your surgeon's instructions for specific incision and dressing care. Lastly, the nurses will let you know who to call if you have any problems and confirm your follow-up appointment with your surgeon. The nurses at the hospital or surgery center will make sure you know who to call when you have problems when you get home. These are the types of problems you will want to call your surgeon's office about. Pain or muscle spasms that do not get better even with medicine. Signs and symptoms of infection like redness at the incision, an opening in the incision, a fever of 101 degrees Fahrenheit or higher, or warmth in the area of your incision. Any drainage from your incision that is yellow, green, or has a bad smelling odor, a headache that gets better when you lay down, a new cough or phlegm, burning when you pee, or the need to pee more than usual, new leg pain, or redness, warmth, or swelling in the calves or thighs, especially when you are walking or when you stretch with your toes pointed up. You had neck surgery and you have trouble swallowing or a sore throat that lasts longer than 5 days. Please call 911 right away if you have any chest pain or shortness of breath. Before this video ends, I would like to go over a few important reminders. Remember, no BLTs, no bending, no lifting anything more than 5 pounds, and no twisting after your surgery. You may have been given a notebook or education packet. This may be in hard copy or digital. Feel free to bring this to the hospital with you to use as a reference. We can also provide you with a digital copy at the hospital. Finally, know that the spine care team at WellSpan is here for you. Please call your surgeon's office if you ever have questions or concerns before or after your surgery. You have now watched the second spine surgery video. This video was to help you learn what to expect after spine surgery. Now you can watch the third video called WellSpan Health Spine Surgery Video Part 3. This third video will be presented by one of our physical therapists. They will go over specific information about your spine precautions and show you techniques like log rolling to get in and out of bed, best sleeping positions, and how to get in and out of a car, and much more. Thank you for choosing WellSpan, and good luck with your surgery.